Governor Pat Quinn presented his budget this week, but some lawmakers say his numbers don't add up. That's up next on Capitol View. Hi, and thank you for tuning in to this week's edition of Capitol View, the show where we talk about Illinois politics and government. I'm your host, Jamey Dunn from Illinois Issues Magazine, and with me today is Andrew Thomason from Illinois Statehouse News. Drew, thanks for coming.
Good to be here.
Pat Yeagle here with us from the Illinois Times. Pat, thanks for being here.
Thanks for having me.
And Chris Wetterich, Statehouse reporter for the State Journal-Register. Chris, thanks for coming.
Thanks for having me.
So Governor Pat Quinn presented his budget to lawmakers this week. What was the overall impression you guys got just from the speech itself?
I thought it fell kind of flat, actually, sitting in the chamber. It didn't seem like there was much reaction on either side of the aisle to it. You know, these things, you expect people to stand up, clap when they hear something they really like, and I didn't really see that happening this time.
So not a lot of enthusiasm in the chamber. Chris, what was your feeling on that?
You know, I thought it was notable for Pat Quinn's speech in that, you know, he actually wrote it down and they had a teleprompter and, you know, he used it. He was kind of noted last year for giving a State of the State speech with just kind of extemporaneously, and he had Post-it notes that he was whipping out, and so this was a more disciplined speech. I mean, it may not have been, I don't think there were any memorable lines in it, but you know, it was definitely more focused, and you know, they even had little headers as you ran down the text for each area that he was talking about. So for him, it was an organized speech, and you know, I think it was an improvement over some of his past efforts. Yeah,
it seemed like he really had a plan and stuck with it, which was really noted afterwards. Not a lot of specifics in the speech, though. He didn't give a lot of numbers. He talked a lot about things that he's done to help the state out in the past. He bragged a little bit on bringing business and really focused on job creation and reaching out to the business community. But you know, he didn't talk a lot about human services. He didn't talk a lot about cuts. So I'd like to get into what some of those cuts were. One of the big issues that people have been talking about today is education. The budget called for cuts to transportation funding, which the state gives to districts to bus kids to school. That's been a huge blow up today. Some of you guys, I'm sure, have been following up with districts on how they're going to deal with that. Drew?
Yeah, I was calling around to some school districts all around the state, urban, rural, and it seems like the feeling is that basically it's overall having the amount that districts would get compared to a few years ago for just getting kids to school and back from school. And the kind of general feeling is that we've already seen a lot of cuts to schools. How are we going to make up with this? I talked to the school in Champaign, and they say, we're looking at $2 million in cuts to our budget on top of this. How do we deal with that? Where they get that money, that's still kind of up in the air, and they're not quite sure where to go for that.
Well, and Quinn's staff said, you know, we have other priorities that we have to take care of. They raised the level of general funding, but when it comes to transportation, they're not sure that they can foot the bill anymore. One of the other things that was brought up was the consolidation of school districts. Chris, can you talk a little bit about how these two might play into each other as far as the cuts?
It's kind of an interesting contradiction. You're telling school districts, no, we're not going to give you as much money for busing as we've been giving you, but then we want you to consolidate. And in the suburbs, in the Chicago suburbs, that might not be such a big deal because they're in such close proximity to one another. But down here in central Illinois, you know, we had two districts consolidate several years ago. I mean, you're going to need that busing money if you consolidate schools and you end up closing schools within certain districts. Those kids are going to need to get to school, and they're going to need the money for that. So I'm not sure quite how that's going to work itself out. I'm sure that's a discussion that the districts are going to have with the governor as this budget process goes forward.
You mentioned an increase in general state aid, and some of the schools, I think, are looking at taking that increase, actually, that would go towards classrooms, books, education, things like that, and actually seeing, I'm not sure if they can, but seeing if they can funnel that money into transportation to make up for that loss that would come under this proposed budget.
Which is really the opposite of what Quinn says he's trying to accomplish with some of these cuts. He wants the money to go into the classroom, but if districts can't pay to get kids to school, they're going to look wherever they can. The idea of consolidating districts has always been something that's been decided on the local level up till now. Pat, I mean, how do you think some local governments are going to take the state kind of stepping in and saying, we want to be involved in this decision, we want to maybe push you to consolidate districts?
Well, it's tough to tell. In the past, the state has offered incentives, and that, a couple decades ago, I believe, maybe even up into the 90s, maybe even early 2000s. I'm not quite sure of the years, but the state used to offer incentives for districts to consolidate, and those are no longer available. And now, for them to say, essentially, that you have to consolidate, or else, I'm not even sure if there is an or else, but if they say you have to consolidate, it's basically a mandate that the state is unfunded, and they've left. Quinn's talking about cutting mandates that we don't need, and here he's basically giving another mandate that's unfunded. So.
Well, and the thing with consolidation is, I think generally people say, yeah, that's a good thing, cut down on duplicities and things like that. Consolidation isn't bad as people move away from rural areas and more towards the urban areas. But it's one of those not in my backyard type issues. It's like, that's good for the people over there, but we don't want that. So I think you're going to find some resistance if this comes to fruition.
Illinois, I mean, it's had, it's well known that we have more local units of local government than probably any other state in the nation, at least per capita. I'm sure, we're competitive with California or whatever.
I think we're up there pretty close to the top.
I thought it was kind of surprising. I mean, and there's been this big push for a lot of years to consolidate that, because there are so many different local governments, and they all, not all of them, but many of them receive money from the state. I'm surprised he took, look at schools first rather than trying to do some consolidation, with local government entities, like, do we need dozens of mosquito abatement districts or something like that. I'm surprised you didn't take a look at that first and then maybe gone to the schools, because this has been on the agenda of of people who watch Illinois government for a long time.
Well, in talking with the State Board of Education today, it's something they've been looking at. It's something that they support, but actually implementing it is very difficult because there's so much emotion connected to it. But I think part of the reason why that's being targeted above maybe a township district or a mosquito abatement district is the savings. Quinn says they could save perhaps $100 million, I think, in the first year if they're able to do this. But this plan is very early in its stages right now. He's calling for a commission to look into how it might be accomplished. So it'll be a while before we see something like this happening. It's probably going to take some changes to the law. So right now, people are kind of in the dark of how this is going to pan out in the future. But Quinn's kind of focusing on some of these areas because he's wanting to prioritize other areas of education spending. One of them being increasing the MAP grants for folks who need money to go to universities, focused on community college spending. So he wants to give people more money to attend community college. And he's calling for cuts to the legislative scholarship program, which legislators basically dole out. They get a certain amount that they get to dole out. Pat, you were a little bit interested in that cut. Can you talk on that subject a little bit for us?
Yeah, what legislative scholarships are essentially is each legislator is allowed to give out, I believe, 2 scholarships. There are essentially tuition waivers, 4-year tuition waivers to whomever they deem academically excellent and willing or able to go on and succeed. And these are good for any of the 10 state universities.
And they're not need-based specifically,
right? They're not necessarily need-based, yeah. But essentially, it requires the universities themselves to subsidize each legislator's picks. So the universities are picking up the tabs when they're already in deficits. Many of them are running deficits because of late state payments. And this is essentially, I think, Martin Sandoval actually said that state universities are a tool of largesse for the legislature, and I think he might have a point there.
As far as they get a little bit of prestige by getting to hand out these scholarships. It's a little feather in their cap. And it's been called for an elimination of this program for years now, so we'll see what happens. Chris, what do you think the odds are in this kind of thing?
Not very good. I mean, I think they like having those scholarships, and many of them can point to committees that they have formed to give them out on a merit or need-based, basis. I mean, two of our local lawmakers, Larry Bomke and Sam McCann, both said that they would not give them out, but the majority of our local lawmakers around Springfield still continue to want to give them out. It's a perk that they like having, and since they have to take it away from themselves, it's just not very likely to happen, I don't think.
Yeah, and Quinn's argument on this is basically, if taxpayers are paying for something, we should give it to people who need the money,
right,
and base it a lot on that concept. And enrollment rates in community colleges have just been spiking in recent years. People, looking for training in the recession, so he's wanting some of that money to go towards people getting to go back to school and maybe get retrained and find new work. So one other education cut that's come out that looks like it's going to be somewhat unpopular with school districts is cutting funding to regional school superintendent offices. They do a lot of administrative work. They handle some certification issues. They handle some making sure schools are up to different codes. Drew, we were talking about this a little bit earlier. What do you think the impact on some of the school districts is going to be if they lose these offices?
I think that generally, like you said, these are a lot of administrative positions. So what would happen if they lose these offices is either that administration would be handled locally, or it would have to be handled by the State Board of Education. So you might, I believe the estimate is $13 million the state would save by eliminating these. I'm not sure if that is a true number, or whether you would see local school districts and, like I said, the State Board of Education have to take on some of that burden, and so that kind of number, I think, could be played with a little bit.
Basically, a lot of these functions have to be done somewhere.
Mm-hmm. So
that, coupled with the transportation cuts, could mean a shift in people paying higher property taxes, possibly, or
possibly. In fact, basically the situation is that they are losing money, and a lot of the money that they are normally rely on from the state is not going to come in, so they have to make that up somehow. And the other mechanism for funding schools is property taxes, and so that's going to probably be on a lot of ballots in the coming years if these cuts are made. And another issue is that with these regional offices of education, a lot of times smaller districts, like you were saying, rural districts, a lot of times hand off these administrative functions because they don't have the capability to do it themselves. Fingerprinting, a lot of other things like that.
They do background checks on people that work in the schools.
Yeah, background checks. They just don't have the capability to do these things. And so if you take that away, essentially you're going to have someone else do it, but then it's probably going to cost more if you have the State Board of Education do it, because then you have, you have to add on another set of bureaucracy there. It's basically just shifting costs from one level of bureaucracy to another. I mean, there may be some savings, or it may actually go up. It's tough to tell.
Well, you mentioned property taxes, and I think that calls into question, being on the ballot, how willing are people going to be, after having a statewide income tax increase, how willing are they going to be to vote for their property taxes to go up? I really question the willingness of that.
Sure.
Well, let's move on from education to another area that makes up a lot of the state spending, healthcare. Quinn has proposed to cut what the state pays doctors and other healthcare providers for providing services to Medicaid patients, which is Medicaid is the state program that helps out people in need to cover their healthcare costs. He says that this could result in $550 million in savings, but it's going to be a really, really contentious issue. There's been some access issues where doctors are saying we're not making enough to make it worth us taking these patients. How could this play out?
It's really interesting because we asked that question at the governor's, his staff's budget briefing, and we said there's already a shortage of medical professionals that will accept Medicaid because your reimbursement rate is so low, and that they've had problems in the past with getting their money on time. That changed with the federal stimulus program. There was a minimum of there was a maximum amount of time the state could take to pay back providers in order to get the federal funding.
They had to keep a 30-day cycle.
Right, they had to keep a 30-day cycle. but the governor's office claimed that they were going to meet with these providers, and they kind of singled out hospitals and nursing homes as being the two areas of healthcare that would be affected by this. And they basically said, well, we're going to work out these reimbursement rates with them and come to some kind of agreement. You know, yesterday the Hospital Association kind of protested these cuts, so I mean, there's certainly no agreement yet, and I think that people are very fearful that these cuts will, you know, will further diminish the amount of providers that provide health care to poor people. So, you know, I'm not sure where this goes, but.
Now these rates are set by contract, right? So they would have to negotiate and work this out, or can they pass a law just to change this?
I'm not completely sure about that, but you know, I think that you know, the providers are objecting to their rates being even lower than they already are, because the state pays some of the lowest Medicaid reimbursement rates in the country, and if not the lowest.
And it seems like Quinn's staff, at least in the budget briefing, seem committed to working on coming to an agreement, at least for now, with those providers. They're just trying to work something out.
There weren't very many specifics. I mean, they kind of basically said, well, you know, these certain rates for certain things are out of whack, and you know, they weren't real specific as to, you know, what specifically they were talking about and how they were going to get the hospitals and the nursing homes to agree to what they were proposing.
And do you think they're targeting hospitals and nursing homes to some degree because they're large institutions, and the idea would be maybe they could absorb some cuts? Possibly.
I mean, Medicaid's a popular area to try to cut because, you know, the state spends a lot of money on it. I mean, it's definitely in the top number of programs that cost the state money. And you hear, you know, Republicans all the time proposing that there be Medicaid cuts. So it may be another kind of way to throw the other party that, you know, a bone, basically.
And let's not forget that it also affects the disabled. One of the disabled bloggers that I follow was talking about the cuts to the services that disabled people would get under Quinn's plan, and he essentially said that people who rely on the state for their entire income because they can't work, I mean, there's simply no way for them to work with their disability, they would essentially be cut off because the cuts would essentially eliminate their what they receive. So it's, you know, it's obviously not just poor people. There's disabled, and I think there's a couple other classes as well that will be affected by this. It's going to affect a lot of people.
Well, that moves us into the other area of large cuts, which is under human services. You know, the biggest spending in the state is basically education, healthcare, and human services, and they all took their hits to some degree. And Pat, you touched on in human services, a lot of the cuts will be to mental health care, to treatment for addiction, and to some degree for developmental disability and people that have challenges such as that. So Quinn didn't talk about this a lot in the address, but the numbers are there. What were you guys' reaction to some of these cuts in human services?
I think on the human services side, speaking of you know, mental health, he didn't mention it a lot in his budget, but there was kind of some backroom not dealings, but there was a document that was released the day before his budget address in which it outlined how much is owed to each vendor in the state, basically. And if you go and you look through those lists, townships, counties, municipalities, they're owed quite a bit by the state, but also there's a lot of mental health institutions, the mental health wings of hospitals, that have millions of dollars owed to them by the state. So you kind of are seeing almost like a double hit to those institutions right now. And
another thing with that is that when you take money, when you don't pay back your mental health providers, they cannot provide services to people who have mental issues, and those people are statistically higher in terms of committing crimes. So you basically take them out of a mental health institution where you can treat them, and instead you end up putting them in the Department of Corrections where they don't get any help, and it's more expensive to hold them, and essentially you're robbing Peter to pay Paul, essentially.
Yeah, that seems to be the case with a lot of cuts to the state budget in general. A lot of times it's just shifting costs to another area. The human service providers that I spoke with yesterday echoed that same idea, that people will end up in emergency rooms and they'll end up in corrections, and we'll be spending money there instead. Another one of the big cuts that's coming in human services, as I mentioned, was to addiction services for prevention and for treatment. And one of the issues with that is folks who are not covered by Medicaid will basically no longer be able to get services that are funded by the state. There is some federal funding coming, but what does that mean for people with addictions that if they're not covered by Medicaid, what are they going to do now? Are we seeing a lot of people ending up on a waiting list? Have any of you guys chatted with human service providers in the last few days? Or?
Not really, but I would expect that's what's going to happen, is just longer lines, essentially, as people wait for or get turned down for services. I think, I'm not sure about addiction services, but you'll see some of this picked up by the national health care thing, but doesn't kick in for a while, so you have this gap of time in which services won't be provided to these people. Yeah, in 2014, a lot more people will be eligible for Medicaid, so they'll have that coverage. I think the concern is that we're cutting the infrastructure for that now. There's some worry that the providers may not be able to hold out until then. Well, I want to move on a little bit to some of the disputes with Quinn's numbers. He is basing this budget on a big borrowing plan, $8.7 billion, to pay down our unpaid bills from previous fiscal years. So his budget is balanced for the upcoming fiscal year, basically, but there's no money in it to pay these old bills. So can he call this a balanced budget? And can he count on this borrowing coming through? It looks like Republicans are not real happy with this idea right now.
It's not balanced without the borrowing. In fact, it's more than $8.7 billion if you believe what they were telling us in the budget briefing. It's $10 billion is basically the budget gap without the borrowing, to pay down those back bills. So, the answer is no. I mean, it's amazing because we had this 67% tax increase, and yet we're still in a deficit. The governor's spin on the $8.7 billion, and I think it's pretty credible, is that this is money we've already borrowed from the providers who we haven't paid. We forcibly borrowed it from them. So basically, all he's proposing to do is to basically borrow that money from bondholders rather than the people that are providing the services that the state hasn't paid for.
I think what you'll see is borrowing in the end, but not the $8.75 billion that the governor's asked for. It seems yesterday after the budget speech, listening to Republican leaders, they didn't exactly rule out borrowing, but they said that they had a concern with the amount of borrowing. So I think in the end we'll see some bonding to pay off this backlog of bills. What that is, I don't know.
I think they want to extract a pound of flesh. They want more cuts. That's what they've been saying since the election. And the governor in his speech, it was probably the most memorable part of it, was he challenged them to come up, if they don't agree with the borrowing or the amount of borrowing, tell me what, his quote was, tell me what bills we shouldn't pay, basically. And we've yet to hear from the Republicans on what that would be. I mean, Senator Baumke told me yesterday told us that he expected to have a list at some point from the Republicans on what they thought should be cut. So I think Drew's right. It'll be less than $8.7 billion, and the balance between $8.7 billion will be the cuts that I think they'll have to propose. And
as Rich Miller today pointed out in the Capitol Facts, that Quinn today signed, right after the budget address, he signed the bill that requires him to make his budget based on expected revenue, which would have specifically made his budget illegal.
Yeah, it was interesting. All these new reforms were passed, and this is supposed to be a new year of budgeting, but those reforms did not get signed until after the budget was actually introduced. And it seems that the leadership on both sides in the Senate is a little concerned that some of that borrowing may end up going towards new spending, or at least towards the new budget. So I think what we took away overall was that there aren't a lot of specifics yet. People still have a lot of questions going forward. So another issue that came up a lot that day when the budget was released was, what are we going to do with pensions? We've already done some cuts to future pension benefits for people who were hired this year and going forward, but some lawmakers are looking at cutting future benefits for people who were hired before that change. Chris, we were talking about this a little bit today. Can you kind of lay out what's going on?
It's a really fascinating thing because the Speaker of the House, Mike Madigan, a longtime ally, I think, of unions, although I think they would probably dispute that today after the last couple of years. He basically came out in the last week, and he again talked about it yesterday, in his comments after the budget address that he wants to change pensions for existing workers going forward. So that would mean that all the benefits that they would earn up until now, or up until those pension changes would be made, would stay the same. They wouldn't be reduced. But going forward, pensions, any future benefits that they accrued would be, would be reduced. There would be some kind of reduction. The House Republican leader Tom Cross has a plan where workers could select amongst 3 different plans. They could stay in the current plan, but they would have to pay significantly more out of their own pockets, to stay in there. They could go under the second-tier pension plan that was passed last year for workers that were hired after January 1st, or they could go into some kind of 401k style plan in which they're, it's a defined contribution rather than a defined benefit. And I think it's a really fascinating issue because it seems like Madigan is slowly trying to get all of these issues that the Republicans throw on the table. It seems to me that he's kind of trying to sweep each of them aside. And yesterday he went a step further and said basically that, should they pass the plan in the House, which it seems like he plans to do, I don't know what the plan will be, and I don't think he does yet either. If he is, he's not saying. But should they pass it, it'll be up to the Supreme Court to decide whether or not it's constitutional or not. As you know, many people feel that changing pension benefits for current workers is unconstitutional because of a clause in the Constitution that basically says that.
Mm-hmm. And Senate President John Cullerton being among those people, so
right.
There may be some dispute of whether it will get called in the Senate, how far it will go.
Well, I think he's basically said that if it comes over from the House, that he would call for a vote. He thinks it's unconstitutional. He will vote no, but it doesn't mean he would block a vote. Cullerton's different from Madigan in that he doesn't bottle stuff up in the Rules Committee necessarily, or the Assignments Committee is what it's called in the Senate. But then you have the governor as well, who has said in the past that it's unconstitutional. Although his budget officials during the budget briefing said that that he was open to changes to pensions that could be negotiated with the unions. Mm-hmm. So I don't know. It was kind of cryptic and not very detailed again. So I'm not sure what kind of framework they would have in mind there. But Quinn seems to be loosening his stance on that a little bit as well.
Yeah, he can be hard to predict on these kinds of things. I would say in recent months, it'd be safe to say he wouldn't sign this, but I don't know, the tide seemed to be turning.
He changes his mind every once in a while.
Yeah, well, that wraps it up for this week. We've got plenty to talk about in the coming weeks with the budget. Thank you so much for coming on the show today, guys. I'd like to thank Andrew Thomason from Illinois Statehouse News, Patrick Yeagle from Illinois Times, and Chris Wetterich from the SJR. I'm your host, Jamey Dunn with Illinois Issues Magazine, and I'd like to ask you to visit our Facebook page when you're surfing the net. Just search on Facebook, Capitol View, one word, and come check it out. Thanks for tuning in.